Today's class will be on administration of the drugs, mainly the parenteral, using Mannequins. Okay, as this is a practical class, little bit about the theory. Okay. So, what are parenteral routes? Routes are than the enteral routes. Okay. Some advantages like faster bioavailability. Okay, gastric irritation is and vomiting are not provoked. It can be used in unconscious patient, uncooperative patient. Okay, no chances or less interference with food or digestive systems. Okay, it bypasses the first pass metabolism. Drugs which are having poor bioavailability, that also can be used. Okay, so these are few advantages over oral route. You have seen injections, so they can be of various sizes. Okay, so it can be used for intravenous, intramuscular, subcutaneous and intradermal. Okay, and there are other sites also which can be also used. Okay, so this injection is an infusion method of putting the liquid into the body, usually with a hollow needle and syringe which is pierced through the skin to a sufficient depth for the material to be forced into the body. Okay, so what are the parts of this? This is the needle, this is the barrel, this is the plunger, this is known as the syringe. Okay, and this is the needle cap, and these are the other syringe types. Okay, so here in the type of injections we have said that intradermal, subcutaneous and intramuscular. So what are the range of syringe? Okay, according to the gauge classification. So do you see any difference here?
Gauge difference according to color.
Gauge difference according to color and also the thickness, isn't it? With the increase in the gauge, the thickness decreases. Okay, so intradermal is 25 to 27 gauge. Okay, subcutaneous is 23 to 30 gauge, IM it is 18 to 25 gauge. Okay, and the angle for ID it should be around 5 to 15, subcutaneous 45 to 90 degree, and for IM it is 90 degree. Okay, so try to remember the gauge. Okay, sometimes this color might be different according to the company, but this gauge remains same. Okay, so these solutions you have seen in the other pictures also. So what is this? This is what is the difference? What is this and what is this known as? Which is not sealed, which cannot be reused, it is the vial. So this is the vial. Okay, it can be glass, it can be plastic also. Okay, so what is this? This is the vial. So the thickness of the glass is more here, and there is a seal. Okay, and a cap, so it can be reused. Okay, so this is the basic difference. Okay, so they possess hermetically sealed neck. They may be sealed or not. Ampules cannot be reused, it can be reused. Again, it is oddly shaped, it is flat shaped, temporary storage for longer period of storage. Okay, and as it is not having the rubber stopper, you need to break it and for the access. Okay, and it is having the rubber stopper, so it can be reused. Okay, the liquid solution. So this is the ampule and this is the vial. Okay, so what are the procedures? Okay, for picking the solution from the vial and also from the ampules, we will be telling you. These are the basic steps here written. I am not going into it because today already it is late. Okay, when we will be going into the practicals, we will be describing it nicely. Okay, so this is the picture. First you have to cover your hand with the dominant hand with the gauge, and then you have to break the neck. Okay, then you have to take the solution. Okay, as it is showing, draw it, and here are some checklist for intramuscular. So this you have to maintain according to the steps. Okay, this will carry marks in your exams. Okay, this is from the vial how you take. Okay, no need for infusion. So today we will be discussing intramuscular and the subcutaneous route. Okay, so this intramuscular injection, what is that? So it delivers the medication deep into the muscle, okay, not above the layers, okay. It has to be into the muscle or the muscle tissue. So this allows the medication to be quickly absorbed into the bloodstream for action. Why? Because
serious condition, shock.
Because why? Because the muscle is more supplied by having more blood supply, isn't it? That is why it will be quickly absorbed, okay. You know these layers now, no need to. This is the epidermis, this is the dermis, this is the subcutaneous layer. During the subcutaneous, what is the angle?
45.
45, okay. So the site is here and the muscle it is 90 degree, okay, for deep penetration. That is why. Some advantages of the intramuscular injections, like absorption is more, less variable, rapid compared to oral or SC route, okay. Depot injections can also be given. Or what are the disadvantages? If proper aseptic condition is not done, then chances of abscess at the site of injection, nerve damage and paresis, this can happen, and large volume cannot be administered, okay. Examples such as antibiotics, antiemetics, neuroleptics, testosterone, these are the examples commonly given in the intramuscular route, okay. So what are the sites? This is the deltoid, okay, deltoid. Then this is the vascus lateralis, okay, then this gluteus maximus, okay, then this is the ventrogluteal root. Usually this is not recommended, okay, this dorsogluteal root. So it has to be exactly 90 degree, okay, when you will be giving the injections. So this is the procedure, okay, we will be explaining it to you later in the class. What are the precautions, okay, the aseptic condition you have to be maintained, like use of sterilized needle, syringe, use of distilled and sterile water for injection, handling the drug and equipments in aseptic technique, cleaning the injection site with spirit during transportation of injections, use of the needle guard or projector, okay. So what are the steps for hand washing? Do you know? What are the steps? Can you repeat? First is the palmar area, then the dorsum, then the between the fingers. Fourth is the
Rubbing the fist.
fourth is the fist. Fifth is the thumb, okay. Sixth is the tips. Then seventh is the wrist. Remember these 7 steps, okay. So before wearing the gloves, you should do these 7 proper steps of hand washing, okay. So this is the technique, okay. So we have to use the alcohol swab to clean the skin primarily. Then we have to hold the muscle firmly, insert the needle into the muscle 90 degree angle in quick firm motion. After you insert the needle, completely release the grasp on the skin, then gently pull back the plunger to check whether it entered into a blood vessel or not, okay. Then if no blood appears, inject the medicine and the injection slowly with the plunger, then withdraw the needle and the syringe, press with the alcohol swab again for a minute and then wait, okay. So you have to start with hand washing, wear the gloves and do all the procedure, discard the disposals according to the waste management, and the last step is you have to wash your hand again, okay. Remember, don't forget it. So this is the picture. You have to clean the area, then you have to hold the muscle, okay. So here so this technique is not done now at present, it has been updated and it is known as Z-track technique, okay, for giving IM injections, okay. What is the Z-track technique? That is different, okay, but for
You have to pull the muscle.
yes.
and then-
So in IM what happens, above the muscle there is subcutaneous tissue in the layer of the skin, so we just gently stretch the skin laterally, okay. So what happens is when we are injecting the needle inside the muscle, okay, and giving the medicine there, then after we release it, so there becomes a seal, okay. So the advantage is that it is not leaked. Sometimes blood and other body fluids can leak out. Okay, their medicine also can be leaked out. So that is the advantage. Okay. So there is a temporary seal. Okay. So that is the advantage. This is the waste management. Okay, you know it. Okay. Where should be the glasses and the needles should be discarded? Why? Syringes should be in the blue. For glasses and needles, white में, ठीक है. Blue में plastic and gloves, syringes. This should be, syringes should be in the blue. In yellow, anatomical waste. Okay, human waste, and infective dressings and popcast should be in the red. In the black, all the cytotoxic drugs and all. Okay. So, so what is the angle for subcutaneous? It is 45. It should be 90 to 45, not less than 45. Okay, between that. Okay. Then what are the advantages? It is smooth but slower absorption for a longer period of time. Okay. Then depot injections or implants can be given. Some advantages like small. It is introduced only. It can introduce only small volumes of drugs. Okay, like 1 ml or 1.5 ml of drug. Okay, eaten drugs cannot be administered. Okay, why? Because the more you are closer to the skin, the more there is nerve supply, more sensitive. Okay, that is the reason. Not suitable in cases of shock. Okay, शॉक में जनरली क्या करते हैं हम लोग? वी उसके लिए कौन सा रूट बेस्ट है? IV route. Okay, and examples in for SC are local anesthetics, insulins and vaccines. Okay, so these are the common sites for SCs. Okay, lateral aspect of the lower arm, abdomen, thighs, backs, loins and posterior part, okay, of the arms. Okay, so in IM it is Z-track technique. Okay, you have to shift the skin laterally. Okay, in SC it is lifted skin fold or lifted up technique. Okay, here what we do is we just pull or lift up the area of the skin where we will be pushing the injection. Okay, so what is the advantage of this? इसमें भी seal हो जाता है. So what is the advantage? See, when you will be pulling it, you are giving more surface area for the injection. So less chances of IM, muscular penetration. Okay. So your pinch shouldn't be like this. It should be a little bit less, around 1 inch. Okay, around almost 1 inch. So it shouldn't be going too deep, so that muscle comes up. Okay. This is a checklist for SC. This is the procedure. So these are the various angles for IM 90, for SC 45, IV 25, interdermal 10 to 15 or 5 to 15. Okay. IV today are not going. Okay. From parenteral, which one? Intramuscular and SC. Okay. So what is the first step? No, before consent.
Explain the process.
Before process?
Introduce ourselves.
Yes. So this is the first step. So first of all, you have to introduce yourself. So introduce yourself.
I am Dipankar, second year medical student from Tripura Santiniketan Medical College.
Okay. Then after introduction,
Then I'll explain the process.
procedure. Okay. So what procedure today you'll be doing?
And
The intramuscular injection. Okay. Then
Then I'll take consent if the person is comfortable.
then
Then I will have wash my hands and make it septic, sir.
consent. If yes, then.
Then
If yes, then. Okay. Then you'll, after taking the consent, you will, what you will do?
I'll wash my hands and make things septic, sir.
Hmm.
I'll make the area septic.
Hmm. Then
Septic, sir. Then I'll wear gloves. Then
what is the proper step of hand washing? First is the palmar surface, then the dorsal surface, then the between the fingers, fourth is
Thumb.
okay, thumb, then
Thumb,
fifth
then
is
fingertip.
fist, then
Then
It's like that.
this is the last
Fingertips.
fingertips.
fingertips,
This
yes.
is the sixth, and seventh is the
Last.
Yes.
everyone.
Yes.
Okay. Then is the how you will wear a gloves. So do you know how to wear a gloves?
Yes, sir.
Okay, show me. So suppose we don't touch this. Okay. Suppose this is the gloves. Okay. So first of all, before touching the glove, what you need, what you need to ensure before touching the gloves. Okay, then
And then I have to sanitize myself first.
you have hand washed it. There is, after that only you will be wearing the gloves. Anything?
Then I will open.
The first is you have to see that the gloves is sealed or not. Okay, it might not, it might be broken, it might be contaminated. So first of all, seal is there or not, properly sealed. Second is after opening the seal, then you have to see this size. Okay, sometimes it might be too tight, too loose. Okay, it should properly fit your hand. Okay, then comes the which side, either it is right or left. How will you understand it is right or left? By the thumb, anatomical position. Okay, if right, then it should be towards your right. If left, it is towards your left. Okay, then how will you wear?
My thumb.
Which side you will touch, which side you want, which is the sterile part in the gloves, most
Outer
sterile,
side is the sterile part.
outer sterile. Okay, so how will you wear? I think you have touched the outer part. So this is the
Okay, okay. To understand which hand.
okay. First, which hand you will introduce?
Right.
The dominant hand. Okay. How will you introduce? Go. Before introducing, one more thing is that you should always remove your jewelries and ornaments. Why? Because it might not be properly sterile, and also there is chance of gloves tearing. Okay, it can tear the gloves. Okay. Go slowly. Okay. Go slowly. Don't touch that. Don't touch the outer part. Go slowly. First introduce your tips, then the rest of the hand. First introduce your thumb. Serial wise introduce your other fingers. Don't touch the outer part. I think your middle finger is not entered. You go serial wise, okay? Thumb, index, this, okay? Serial wise you try to. So, which gloves you will be wearing when you will be doing such kind of procedure? Only this surgical gloves, not these loose gloves. Okay?
So what is the name of these gloves? Sir? These surgical gloves. What are they?
These are for regular uses. Okay? There is a box. This not particular name is not there. This is a brand, I think.
Nitrile.
Okay. Then what about the left? Which part is sterile? Wait, which part is sterile? First understand.
This one is sterile. This is not sterile.
No.
Yes, sir, this is not
Inside is not sterile. So you cannot touch the inner part by the sterile hand. So which part you will be touching? How will you introduce? So the outer part should be always outer. It shouldn't go in, because it should be always outer side. Okay, shouldn't go in. Okay. So as you have wear the gloves, whether it is fitting to you or whether it is loose or tight, what do you think?
It is fitting.
Okay, but I think it should be a bit more fitting. Okay. So after wearing the gloves, what is the next step?
I'll sanitize my hands.
This is sterile. After that,
I'll take the vial.
you have to locate the site. Okay, locate the site of injection. Suppose for IM injection, you will be taking which muscle? Deltoid muscle. This is which arm?
This is left hand. Right hand.
This is left hand.
Left hand.
Okay.
Left.
Left hand. Okay. So what is the next step? You have located the arm, you have located the muscle, then you have to locate the site. Okay. How to locate the site? If you are going for IM, no, that is the technique. But before the technique, you have to locate the site. Where you will be injecting? Where is the location in that muscle? Do you know? So the location is 1 inch or 2 to 3 fingers below the acromion process. Do it like this, 2 fingers. This is the acromion process, like this, 2 fingers. Okay. So 2 fingers below that, this area. Okay. So this area will be injecting the needle. Okay. And now you have to disinfect the area. So how will you disinfect? Alcohol swab. Okay. This alcohol swab you will disinfect. So what is the procedure of disinfecting the area? Do you know?
Circular, sir.
पूरा सर्कल बाहर से अंदर तक जाना
अंदर से
एक
circular fashion.
Circular fashion में जाओगे either clockwise or anti-clockwise. You have to go from inwards to outwards. Okay, this is the fashion. Okay, so you have to do this 3 times with 3 separate cotton swabs. Okay, sterile swabs. Okay, this is used. Keep it there. Okay, now you have disinfected the area. Okay, what is the next step?
next step sir I'll take the vial.
Okay, then you have to wait for air dry. Remember in your physiology, okay, you have to air dry it. Okay, then after that you have to check the medicine, the level of the medicine, because it is the one or not. Okay, what the things you'll be checking here?
It is sealed or not.
Okay, first sealed or not, then first is the name of the drug, whether the name is correct or not, which will be introducing it. Okay, then after name,
Expired.
dose. Okay, how much dose you'll be introducing, then manufacturing, expiry, then the color of the solution. Sometimes it might be within the expiry, but the color might be changed. Okay, so you have checked it, this is fine. Okay, so now you will be taking from a vial or a ampule. Which one? Vial. First, do you know how to take from an ampule? Okay, so in the ampule, actually we are running shortage. Okay, so suppose this is the ampule. Okay, I'm considering this is the ampule, and so it will be a bit thinner, and the glass is also will be less thick. Okay, thin, and it won't have this seal. Okay, so we have to break it. Okay, so how will you break? What is the procedure?
We'll take a gauze or something.
We have to take a gauge. Okay, we have to take a gauge. Okay, then so there is a neck. Okay, you have to hold the base with a non-dominant hand, and with a dominant hand you have to hold the neck, and there will be a line. Okay, where it will be breaking. Okay, at that part you have to press it firmly. Okay, and it will break. Okay, what is the use of this? Why I'm using this?
So that the glass particles doesn't enter the fingers, sir.
Yeah, with the sharp objects I do not injure myself.
Yes.
Okay, that is the thing. Okay, it will be saving me. Okay, so you have broken it. Okay, and now this is the vial. Okay, now how you will be taking the medicine from the vial? First, okay, first, what about this? What are the parts here?
Piston.
This is the cap. This is the cap.
Cap, needle.
This is the needle. Then barrel. This is the plunger, and this is whole. It is known as syringe. Okay, so now how you will be taking the drug? This needle is also having a part. This tip, bevel. Okay, So how you will be taking the drug? Can you tell? Can you tell?
So by inserting the needle here.
Okay,
and
so
using the branch.
okay, so you have to introduce. Okay, okay, so you have to introduce the tip of the needle in such a way that the tip doesn't touch the outer portion of the ampule. It should be directly going into the ampule. It should be submerged, okay, in it, and then you'll be drawing it, okay, according to your ml. Okay, how much ml, how much amount of drug you'll be taking. Then what is the procedure? Then what is the procedure? Can you tell?
After taking this, we'll
Suppose you have taken the drug, okay, from the ampule. You will be taking 1 ml. So if you're taking 1 ml, at least take 0.1 ml or 0.2 ml excess. Why? Air bubble and also wastage, okay, for wastage. Sometimes it gets waste, okay. So I am taking how much ml here? 0.1, 1.1, okay, 1.1, okay. So I will be removing the air bubbles like this, tapping, and then like this. Now I have taken properly 1 ml, okay, 1 ml have been taken, okay. Can you see? Okay. So now what is the next step?
so we will inject.
You will inject, okay. So before injecting, what are the things? So for IM, which technique should be used? That is known as Z-track, okay, Z-track technique, okay. So what is the Z-track technique?
Literally.
You have to laterally pull or shift the skin, okay. How will you shift? How will you pull? So which is the lateral side? So lateral side.
This is late.
This is lateral.
Lateral.
Mm,
Yes, sir, this is lateral.
this is lateral, but deltoid dead is middle. Anatomical, anatomical, yeah. Anatomical. Yeah, this is mismatching is there. Okay. So if this is the deltoid, suppose I am considering this is the medial and this is the lateral. So stretch this side. Okay. This way you will stretch. Try to stretch in this way. So after stretching, you know the site of location where you will be injecting it. Okay. Now what is the direction? 90 degree. No. For IM it is 90. What is the 90 degree? It should be directly perpendicular.
Yes, sir.
Hmm. This is not there, yeah? It was a bit less, no? 2 fingers less than that. Hmm. So when you will be injecting it, how should you inject? How should you inject? It should be fast. It should be fast and firm. Quick. Now you have to go quick. Go quick. Okay, inject the needle there. No, you have not injected. Insert it. It is not 90 degree, madam. 90 degree means properly perpendicular. Go. Don't inject now. Just insert the needle. Remove the needle. Take the solution again. Don't go fast, okay? Go slow now because you are learning, okay? We know the site. We have stretched the skin, above skin. Now inject it perpendicularly, directly insert. Don't introduce the medicine.
Okay.
Go more. Okay. Suppose now you have gone into the muscle. Okay. What is the next step?
Inject.
No. We have to check. We have to check whether it went into a blood vessel because the muscle is more vascular, more blood supply is there. Okay. So to check, how to check it? We have to aspirate or withdraw the plunger. Okay. Do it. So if blood comes, then
We'll back off.
we'll remove the needle. Then
Try.
we'll go to a new site with new needle. Okay. If no blood comes, then safe. Now you can introduce the drug into the muscle. Okay. So what should be the force and how much time will take here? No.
Fast and firm.
No, fast. The introduction has to be fast, but the introduction of the drug should be slow. Around 30 seconds, 30 to 2 minutes. Okay, that time. Go slowly, introduce it.
It's not moving.
it will go. Go slowly. 30 to 2 minutes. Okay. 30 seconds to 2 minutes. Okay. Now wait. Now take the swab and put it there. Remove the needle. So now you have to wait for 1 minute. You have to wait for 1 minute and with gentle pressure with the swab. You have to discard this needle if there is proper disposal according to the waste management. If not, then you can reseal it. Okay, reseal it and kept in any area where it should be disposed. Okay. So after 1 minute, what is the next? Next is for next 15 minutes you have to observe the patient for any adverse reaction. Okay. You should be waiting for 15 minutes to see any adverse reaction is happening or not. Okay. So if no adverse reaction is happening, the patient is fine. Reassure the patient, greet the patient. Okay. Then what is the next step? All the waste should be disposed according to the waste management. Okay. So the needle should be going in the white. Plastics, the syringe and all, gloves and all should be in the blue. Okay. Glass also should be in the white. Okay, fine. After that,
Done.
no. Last I told you na.
Gloves.
Gloves भी discuss कर दिया. Last.
The surface area.
No, last one.
Sanitize.
Not sanitize. Washing the hand. This was the last, isn't it? First was you have started from the hand washing. Last also should be in the last step. Okay. Probably you have done the Z technique. Okay. So what is the next one? It was subcutaneous. So how will you do? How will you proceed for subcutaneous? Same things. First of all, you have to
Change the angle.
no. First of all, you have to again
Know the area.
introduce yourself.
Okay.
You have to start from the first point. Okay. Then
Explain the
procedure.
procedure.
Then consent.
Then take the consent.
If yes, then
If yes, then
And I will check where we have to
so locate the site.
locate the site.
For SC, suppose you are taking the lateral aspect of the arm. Okay. Then locate the site. Then
After locating the site,
you have to clean the area. Okay. Okay. Before cleaning it, you have to hand wash, wear the gloves, clean the area. How many times?
3 times.
3 times. Then air dry. Then
We'll take the vial.
suppose now you'll be taking from the vial. That time you have taken from the ampule. You know the technique for taking from the ampule solution. Now how you will be taking from the vial.
So first we'll check the drug name,
Labels.
labels,
Drug name, dose, manufacturing, expiry, and the color. Okay. Then if it is fine, then
then we'll proceed.
so in this vial, actually it is having an first a plastic cover. Below that there is a rubber cover.
Yes, sir.
Okay. So you have to remove the plastic cover. When the plastic cover is don't touch. After removing the plastic cover, this cover will be there. Okay. So here you have to sterilize, you have to disinfect the area again. This one. Okay. Same way, circular motion, you have to disinfect that. Then what is the procedure? To take the medicine from the vial. How will you take, do you know? So you have to take a syringe. Suppose you will be taking 1 ml of the solution. You have to take twice the number. Okay, 2 ml, at least 2 ml. Okay. Now how you will be taking the solution from the vial? It is a bit different from the ampule. Okay. First of all, you have to check the syringe whether it is properly working or not. This plunger might be defective sometime. Okay, whether there is air or anything trapped inside it. Okay, all is working. Remove it. Suppose you will be taking 1 ml, exactly draw 1 ml of air. Go directly in it after disinfecting the area. Like this. Introduce the air there. Make the vial upside down and then take the drug. Take a bit more. Okay, I am taking 1.1. Fine. Now remove the bubbles or airs trapped and correct your marking. Okay, Now this way it is prepared. Now this is ready to be injected. Okay, now what is the next step?
Sterilize. So you have already sterilized. Currently, है ना? Sterilize. So we'll inject.
Okay, so first is the hand washing कर लिया, gloves पहन लिया, all you have these labels are fine. You have make the medicine ready. Now this is ready to be injected. You have located the site. Now you have to disinfect the area.
Yes.
Disinfect
Sir,
करो.
इस केस में 1.1 लेना है ज़्यादा.
In all cases.
All cases. Okay.
Why? Because of the same reason. A part of it is being wasted, na.
So कितना लेना extra 1.1?
0.1.
0.1.
Little bit more. Okay. Then what is the procedure for SC? What is the technique here?
45 degrees.
This is the degree. What is the technique?
So later, we have to take this.
Lifted technique, isn't it?
Skin
Lifted.
लेके, हाँ.
Lifted skin
से
technique.
ऊपर देना होता है.
Okay. So you have to pinch. So the distance should be around 1 inch. You have to pinch it little lightly. Okay, fine. So now how will you insert it? What is the angle?
45 degree. 45 degree.
This is 45.
Yes, sir.
So half of 90.
Half of 90.
Think in your mind. Okay, half of 90. Okay, a little bit more. Insert it. Insert it. Wait. Now, what is the next step?
So
Check.
This one has to be quick and firm. Insertion of the needle. Then
we'll check.
you have to check. Okay. Here also you have to check.
Blood is
Sometimes, not sometimes. In the anatomically the blood supply is less in the subcutaneous tissue. We all know as this is a fatty layer. Okay, less chances of getting into the blood vessel. But still, for the precaution, we withdraw the needle. We aspirate it for checking. Okay, to avoid complications. Okay, if your examiner asks, you tell in this way. Okay, so check it, aspirate it. If aspirated it,
yes, sir.
blood came.
No.
If blood comes, then same procedure.
Yes, sir.
Same other side.
Difference.
New needle, new site. Discard the old needle. Okay. Then inject it. Complete. This has to be slow.
Slow. 30.
Introduction has to be slow. 30 seconds to 2 minutes. Okay.
So when we are sterilizing the area, so we have to do it before wearing gloves or after?
After. Because all these things are already sterilized. Okay. You have also sterilized yourself.
So I have a doubt. Like, how will we get to know this much needle we have to insert inside?
There is no such thing. You have to just do this procedure, and the angle will determine, the site will determine it. Okay. Because this is a blind procedure. We are not going with a camera. Whether it is going to that perfectly to that muscular or to the subcutaneous tissue. Okay. According to the site, according to the needle, and according to the angle, this will determine it. Okay. Then, after removing the needle, you have to press the area for
1 minute.
1 minute.
we have to wait for 15 minutes for any
Observation of the patient.
adverse reaction. Then, if there is no reaction, then greet the patient, reassure the patient, dispose the waste according to their biomedical waste management. Then, last is hand washing. Then it is finished. Okay. This needle sometimes might be confusing. Okay. If there is waste management near you, if you can discard this needle, you can break it to the needle breaker. You directly discard it there. Okay. If not, that time you just cover with the needle cap. Why? To avoid the needle stick injury. Okay. For that. Okay. Next, come. Remove. You want to do? Okay, come. Remove. Give your gloves. Everyone has to do individually. You try with these gloves. No. You keep it there because there is shortage. Okay. This is the left or right. This is the, okay, fine. Okay, first start from the first point. First start from the first point. Okay. What is the first point? No, first point.
Whether they are covered.
First point.
Introducing yourself.
I will introduce.
I am Shubhashmita Chakraborty, a second year student of Tripura Santiniketan Medical College. Then I'll explain the procedure to you.
Yeah, you was the.
And after the patient gives me permission, if yes, then I'll.
Okay. So, what is the first thing you will do after consent?
I'll proceed with the steps.
What is the steps?
First hand washing.
You have to do by your own. Don't help.
First hand
Let us see. Okay.
then
Hand washing steps. First is the.
palmar, then dorsal.
Then between the fingers.
The fingers.
Fourth is
thumb.
tips. Then the wrist. This is the wrist is the last step. Before that, the fist. Okay. Then
I'll wash my hands and proceed with the gloves.
before touching the glove,
I'll see whether they are sterile or not. After that,
sterile and sealed.
sealed or not.
Then
To get the size.
So size, how do we know size? Like
you have to wear it. Then only you can know. It's not like that. You have to wear it and then you have to identify.
I'll say from nurse to.
Open it. Then
I'll proceed with the sterile part of the gloves.
you're touching the sterile part.
This part is the sterile.
Yes. The whole glove is sterile, but which part you should touch, which part you shouldn't. You are touching the
Sterile. Okay.
most sterile.
Then I'll.
left hand left hand help me with
Left one.
like the So what are these, sir? What are these things?
These are tubes.
It's like vein and artery.
During your intravenous, you'll be using that. You will be using which gloves? Only the surgical. Okay. For your practice, you are using this. Okay.
Yeah, that's it. So even these are surgical gloves, na, sir? Technically.
These are not used for surgical gloves. Means what? So that can be used for surgeries. These we don't use. Okay. Then, because if you open one, you have opened all the gloves. But in case of surgical gloves, it is only one surgical pair of gloves is present in one packet. Okay. These are different debit. Okay.
Then I'll locate the area. Patient. It will be 2 fingers away from the acromion process. And then I'll sterile that area.
Disinfect.
Disinfect that area using alcohol.
Karo,
from
do it.
I'll do this step 3 times.
Mm.
Should I?
Mm. Okay. Then
Now I'll pull the skin of the patient.
then
Pull it in the lateral side.
you have to aerate, isn't it?
Yeah.
It is wet.
Yes.
Then
Pull the skin to the lateral
before
side.
that, before going to the procedure of introducing the needle, you have to check the medicine.
Which
Mm. What are the things you'll be checking?
First the name,
Mm.
then the
dose,
dose,
Hmm.
then the manufacturer number and expiry
Mm. And
color.
the color of the solution. Okay. So if all things are fine, then
Then I proceed.
so if you're taking from the ampule, how will you take?
Ampule, I have to break it with a gauge.
Mm. Okay. If from vial, then
Then it has a rubber
a plastic cap first.
plastic cap and a rubber cap. I have to open the plastic cap and this is the rubber cap. I have to insert the
Before that,
it's sterile. I have to sterile.
disinfect the area.
Disinfect the area
Then
and then I have to take the needle of the
show me. You cannot touch the tip of the syringe. This is also another point. Open it like this. So how will you? What are the things you'll be seeing in the syringe?
if I want to take 1 ml, I'll
Before that, you have to check the plunger.
plunger is
Working
working
on,
or
okay.
not. I want to take 1 ml. I will take extra 1.1 ml. After that, I'll put the needle inside the rubber cap.
Only in case of vial, you have to take as much. You'll be drawing. Okay. You have to inject it the air. Okay. Okay. Then. If you're taking 1 ml, then
1.1.
remove it. Keep it. Now you have to free the
Air bubbles.
air bubbles. Don't touch the needle. Why are you touching the needle? Tap in the barrel. Tap there. Without tapping, these bubbles and air won't be released. Okay. Tap it. Okay. Now whether the mark is fine. 1 ml you have taken. Okay. Then so what is that? You have located the site. Then you have to disinfect it. Disinfection done. Now it is the procedure for introducing the needle. Okay. So how will you introduce? What is the technique here?
It is the Z-tech.
Z-tech. So what will you do?
I'll pull 90-degree angle.
That is the degree, but Z-tech technique means what will do?
Side
Pull the skin laterally. Pull it. Okay. Then inject it. Inject the needle there. Introduce it to the muscle. Go more. Go a bit more. Okay. Now what is the next step? This you have to be fast, firm. Next is
check.
No, blood vessel. Check the blood vessel, whether there is a blood vessel or not. No blood is coming.
Okay. Then it is safe to be introduced. Okay. Introduce the drug. Then what is the next? After introducing the drug, then only you have to release the non-dominant hand, the stretching of the skin. Okay, not before that. Okay. Now you have to press it gently for 1 minute, then
Observe the patient for
15 minutes, then
After that, I have to assure the patient
get the patient, discard the
the needle,
waste, okay, biomedical waste, then
a hand wash.
okay. For SC,
45 degree.
दिखाओ. This is which technique?
Sir,
Lifted skin.
should I take?
Take. How much amount you will be taking?
So 1.1.
How much you are introducing? It should be same. It should be same. What should be the size of the syringe when you will be taking from the vial? What did I say? If you are taking 1 ml, it should be twice. Then it should be 2 ml.
So in this process, I'll take 1.1 in subcutaneous.
Same. How much you will be? After taking, what is the next step? Then
I'll lift up the area.
what should be the size? Size 1 inch. Okay. Then
I'll locate the needle at 45 degree angle.
what is the 45 degree? Let me see. Go in. Now.
Now I'll check whether there is any blood vessel or not.
How?
I'll lift up the puncture and if no blood comes out, then I'll check.
Go. Then what will you do?
I'll for 1 minute I'll put the cotton swab and 15 minutes up to I'll observe the patient.
Then
Hand wash. I will discard all this thing and hand wash.
okay. Next come. Cover it. Everyone is understanding? Any confusion?
No, sir. So why did the gloves get yellow, sir?
I told you these are not proper gloves.
Okay.
There is a reason why it is considered as a surgical gloves. Okay. Take another pair. Bring it here. Bring it here. So what is the first step?
Sir, first step, I'll introduce myself, sir.
Introduce.
Hello, myself, I'm Dipankar, second year medical student from Tripura Santiniketan Medical College. Then I'll explain the procedures, how it will be done. Then I'll take the consent. If yes, then I'll be proceeding, sir.
If yes, then
I'll proceed.
how will you proceed?
First, I'll be washing my hands. First the palmar area, sir. Then ulta, sir.
Dorsal.
Dorsal. Sita, ulta.
Then third is
Yes, sir. Then
between the fingers.
Between the fingers.
Then
Fingers. Then the nail.
keep it there.
Then muthi, sir. Fist. Then the
Tips.
tips of the nails, sir. Then
Anything left?
yeah.
Thumb. Okay.
Sir.
Okay. Then
After sterilizing my hands, sir,
Hmm.
then sir, I'll wear this.
How will you wear?
Sir, the thing is, the sterile part is the outer part.
Hmm.
So I'll be using my non-dominant hand to touch the inner part, and I'll be inserting.
Show me. Go slowly, you will tear. It's not going?
It's too small, sir.
So this is small size
Yes, sir.
hand gloves, okay? See if it is possible, otherwise leave.
No, sir.
Okay, leave then.
It is.
From inside you pull from this side also. Okay. Then?
Then the left hand, sir. Since the sterile part is the outer part,
Do it. How will you localize the part?
sir, 2 fingers down from the acromion process, sir. They are doing separate. Once. Then thrice.
Okay.
Then I'll wait it for air dry.
Okay.
Then after this, sir, take the medicine, sir. I'll first check the label.
If it is from the ampule?
If it's from the ampule, then sir, I'll take the ampule, then use a gauge, and then sir, I'll hold the ampule with non-dominating hand. Then with the gauge, I'll touch the neck of the ampule, I'll break it.
Okay. In case of vial?
I'll just take the vial, sir, I'll check the label, I'll check the dose, I'll check the manufacturing date, expiry date, and as well as the color, sir.
Okay. Then?
And then, sir, I'll be having rubber
Cap.
cap and plastic caps. I'll first remove the plastic cap and I'll use the cotton
Swab.
swab and I will sterilize the rubber caps.
Then?
After this, I'll take the needle, sir.
Then?
Then, sir, for example, my dose will be, sir, 1 ml.
Before that?
Check whether the plunge is working. It's working, sir. Then, for example, the dose which I need is 1 ml, sir.
If the syringe and the needle are separate, like this step,
Yes, sir.
then you shouldn't touch the tip of the syringe.
Okay.
Then?
Then, sir, I'll take the plunger to 0.1 mark extra, sir. After
Then?
I'm ready, sir, then I will take the medicines.
How will you take?
Okay.
You can do it any way. You should have to introduce it, okay? Either up or down. Preferably you should do it by lifting, okay? Opposite direction. Then, how much ml will be taking?
1.1, sir. Yeah. Ready.
Then?
Then I will make sure there's no more air bubbles, sir.
Hmm.
Then I will remove the extra part, sir.
Do it.
1.1. Just I'm done, sir.
Then?
Then since I'll be then I'll just since I will be doing the intramuscular, sir,
What is the technique
technique is
for IM?
just technique, sir.
Just track.
Just track, sir.
What is that just track?
Technique, sir.
Z track. Okay. Where is the muscle?
Here is the muscle, sir.
Then?
I will, sir, pull them
Pull the muscle.
laterally, sir. 2 fingers, sir.
Hmm.
And then look at the spot, sir.
Hmm.
I'll make sure that it is 90 degrees, sir, perpendicular.
Hmm.
While inserting, I'll make it, sir, fast and firm.
Hmm.
After I'm done inserting, sir, I'll make sure if there's any. So when I there's no leakage, sir. There's no
Leakage.
blood comes out, sir.
Hmm. If blood comes, then.
I'll back off and I'll try with new syringe on the spots.
Hmm.
Then I will
Introduce. How will you introduce?
slowly, sir.
Hmm. What is?
30 seconds to 2 minutes. Sir.
Okay. Then.
Then, sir, I'll discard the needles. I'll wait, sir, for 1 minute.
Hmm.
And after 1 minute, sir, I'll observe the patient for 15 minutes.
Okay. For.
To see if there's any reaction, sir. And then I will counsel the patient, sir.
Hmm. Reassure the patient.
Reassure the patient, sir.
Then.
When this is done, sir, this part, then I will discard the needles.
Hmm.
And then I will remove my gloves and then hand wash the last
Okay.
step.
Hmm. In case of SC.
SC, sir, everything will be same. It's just like while doing it, I will use the pinch method and then I will take angle from 45 degrees to 90 degrees, sir. 45 degrees. Sir.
45 degree.
45 degrees.
Okay.